Tobacco is one of the most widely distributed and sought-after plants on Earth. Its benefits these days remain unsung. We are doing something about that here. Included as a minimum of chemical vocabulary, just enough to let the listener know that we do understand the topic. This is not strictly opinion or road.
If you are one of the brainwashed twits who would take away a plant from me, then stop listening. It will either piss you off or bring you to your senses, and your master would not want that.
Many of the benefits and desired effects of tobacco appear with very small doses and are reversed by larger doses.
Therefore, secondhand smoke has the benefits and not the drawbacks of tobacco usage. No, don't thank me.
Smoking during lactation. Its concentration in breast milk is so low that the dose of nicotine consumed by an infant is small and unlikely to be of physiologic consequence. The milk of lactating women who are heavy smokers would contain 0.5 milligrams per liter of nicotine. This information in no way condones smoking by nursing mothers, but is included so that those that will smoke do not get too twisted out of shape by guilt. They should just forget about it, as being stressed out will interfere with nursing. Better smoky human milk than formula or another critter's milk.
Tobacco provides me with often prescribed life-improving medicines. It causes them to be created right inside of me like so. Short-term exposure to nicotine results in the activation of several central nervous system neurohumoral pathways, leading to the release of acetylcholine, norepinephrine, dopamine, serotonin, vasopressin, growth hormone, and ACTH. If I did not smoke, I'd have to buy all this stuff.
If you are being drugged against your will, like so many are, get this. For the countless people sedated by prescribed drugs, here is some good news. Cigarette smokers experience less sedation than non-smokers from several drugs that act on the central nervous system, including diazepam, chlordiazepoxide, and chlorpromazine. Smoking probably acts by producing arousal of the central nervous system rather than by accelerating metabolism and reducing the brain levels of these drugs.
Smoking makes my body more powerful. As a man, I can dig that. I also get a dose of the element lithium, which helps me keep my cool. I get stronger because nicotine causes a discharge of epinephrine from the adrenal medulla, and this hormone accelerates the cardiac rate and raises blood pressure. On the cardiovascular system, the effects are those of sympathetic stimulation. There is vasoconstriction in the skin. This means I will fare better when it is very hot outside, and vasodilatation in the muscles, perhaps some transient tachycardia, and a rise in blood pressure of about 15 millimeters of mercury systolic and 10 millimeters of mercury diastolic. The muscle tone of my trapezoid muscles increases. I can pull harder. Yes, smoking is macho, although it is for mature men only. To be used as required. Cardiac output, work, and oxygen consumption increase. Coronary vascular resistance decreases and blood flow increases in men aged 20 to 50 years. Improved gut function. Taking up smoking has allowed a lot of people to quit the laxative habit, in contrast to the cardiovascular actions of nicotine. The effects of the drug on the gastrointestinal tract are due largely to parasympathetic stimulation. The combined activation of parasympathetic ganglia and cholinergic nerve endings results in increased tone and motor activity of the bowel. Tobacco smoke is a good form of protection from infestation by insects both externally and internally. Bugs and worms do not want to get onto or into us smokers. I use tobacco, so I will not get senile. It has been speculated that the release of vasopressin may mediate improvement in memory, and the release of beta-endorphin may mediate the nicotine-related relief of anxiety and decrease in pain perception. Smokers feel less pain. I'm not likely to get too fat either. Tobacco can lessen one's hunger cravings. The body weight of smokers is on average 2.7 to 4.5 kilograms lower than that of non-smokers. When a smoker stops, he or she typically gains weight in a subsequent year, to approximately the level of those who have never smoked. At one time here in Canada, tobacco was grown in the Okanagan. It was pristine there. Now it is grown in the East, where air, soil, and water pollution is at an all-time high. Finding scary things in or on tobacco is just a result of where it is grown and things added by ignorant people that likely do not smoke. Doc. Wake up, think for yourself. In addition to nicotine and tobacco, there are, at last count, 16 separate molecules that have antiseptic properties providing protection from airborne germs, etc. Smokers did not get hit by the SARS plague while co-workers did. Is that not a corker? Just who are the ones behind all this anti-smoking? To me, they are not acting in my best interests. I do not fault those who dare to come up to me and chide me, for they are but ignorant dupes who do not think for themselves. Here is a real-life example from my own family history. The baby involved was an uncle of mine. A doctor had been summoned. This infant has been holding ear, the doctor said. Go to the store and get a long stem clay pipe and some tobacco. The doctor filled and lit the pipe, and putting the stem into the baby's ear, blew on the bowl. Smoke billowed about. The doc laid the child on its side, bad ear down. Later, when the baby was picked up, it was as though an egg yolk had broken on the pillow. The baby was fine.
This was a far cry from hospitalization, eardrum surgery, antibiotic treatments. A grade 1 teacher noticed that all of the kids in her class had been subjected to having a small tap implanted in their ears, every frickin' one. If this kind of medicine could be avoided, as it was by my grandparents, by just a simple puff of smoke from this most holy plant, then those who work towards making tobacco a prohibited plant do evil. Tiny mites, etc., can get into a person's ears. To get them out, I have held a lit cigarette so smoke would get into my ear. Countless are the insects that bite and burrow. Tobacco protects me somewhat. What protects you?
I am a North American. My forefathers were given tobacco by the Redskins. To them it is a sacred plant. When tobacco is smoked in a ceremonial way, the smoke will carry one's prayer up to heaven. It is their most sacred plant. We note that long ago tobacco was not used by females and the young. In my family there are 4 generations before me that have smoked or used tobacco. I use it also. One is born to tobacco use or suffers from its usage. How could that be a problem of mine?
The smoking of tobacco was for older men only. In women, cigarette smoking is associated with earlier menopause and an increased risk of osteoporosis, believed to be associated with lower levels of estrogens in smokers than in non-smokers. In postmenopausal women receiving estrogens, lower serum estrogen levels are seen in smokers than in non-smokers. It has been suspected that smoking acts primarily by accelerating the hydroxylation of estradiol. Recent evidence also suggested that nicotine and other alkaloids in tobacco inhibits the formation of estrogen by inhibiting an enzyme in granulosa cells, an enzyme responsible for the conversion of testosterone to estrogens.
Egg-bearing females should not take up the use of tobacco. Just wait, being old will come soon enough. So, tobacco is not suitable for use by premenopausal females. It will make them older faster. Although for the female oldsters it may prevent decline. Plus, it is not for males before puberty either. According to those who first used this plant, it is for strong men only. It makes them stronger. A weak man cannot be made strong, but a strong man can be made stronger. Know what you are and act accordingly, or suffer and die. We know that each cigarette requires 25 milligrams of ascorbic acid for detoxification. I notice that many old males who smoke and have low ascorbic acid intake often have onset scurvy symptoms. They look ill, but are just vitamin C deprived. Not me, I make this up by supplements. Also, now and then I stop smoking for at least 80 hours. This is all the time normal self-cleaning lungs need to remove tobacco residues. For your information, prior to human usage of atomics, out-of-control lung cancers were rare. The bottom line here still must be: do not start smoking. If you do start, do not quit smoking. The real objection to smoking stems from the fact that men get pleasure from smoking. Now this is a real bugbear to all females everywhere, none of whom can bear any man getting pleasure from something that does not stem from them. So they have all been dead set against it from the get-go.
Are you a man or a mouse?
Pass the ashtray, please.